About that now with Kuen Loon, the Group CEO of Fullerton Health, and Dr. Walter Lim, who is the Managing Director for Clinical Services at Fullerton Health, overseeing the vaccine program. Gentlemen, good morning and welcome to Weekend Mornings. Great to have you on again.
Hey, good morning, Glenn. Good to be on the show again.
Good morning, Walter.
Morning, everybody.
Nice to have you. And Kuen, let's start with you. Let's talk to us a little bit about what role Fullerton Health is playing in our current vaccine environment in Singapore.
Sure, thanks, Glenn. So first of all, Fullerton Health is an integrated healthcare service provider, right, with operations in 9 countries, and we have more than 600 wholly owned clinics serving more than 10 million lives. We are homegrown. We are Singapore-based. And our core market is really Singapore, Australia, Philippines, and Indonesia. So we have really been involved in this fight against COVID since the very beginning, about a year ago, right? Since we started with serving at the dormitories, we've been done almost 250,000 serology tests, and also been involved in large-scale pre-event screening. But more importantly, right now, we are really involved in the vaccination centers. We are, as of today, running 8 vaccination centers across the island, and each vaccination centers can serve somewhere between 2,000 to 4,000 vaccinations per day, right? And as of yesterday, we have completed almost 175,000 vaccine. Really glad to be a part of this national effort. In fact, it is not just a national effort, but it is really a global effort, right? Really to protect lives, to save lives. But more importantly, as what both gentlemen have been saying earlier, is about helping to open the borders, helping to get life into normalcy as well.
Just jump in there. That's 175,000 vaccines that just Fullerton Health have administered. Is that correct?
That is correct.
Oh,
that is correct.
That's very impressive.
That's a great number.
So we are part of the whole system, together with the public sector and other healthcare providers as well.
Brilliant. And you're also named after my favorite hotel as well. So it just gets better and better. Dr. Walter Lim.
And just for the record, we are not related, right?
I know.
Very, very often, right?
I know. Dr. Walter Lim, I'm still surprised that I have to ask this question, but I do. Why?
Sure.
Why do we need to take the vaccine? There are still skeptics. There are even 1 or 2 conspiracy theorists out there. But I have spoken to Singaporeans who have said to me, I don't want to take the vaccine for all kinds of reasons. 1 or 2 are valid. Some are a little off the wall. So, Dr. Walter Lim, why should we take the vaccine? And could you clear up some of the misconceptions?
Yes, happy to answer that. And, that question is something that needs to be reiterated, not just once, but I think over the course of our programs, we do reiterate this to everybody on an ongoing basis. I think a few key things. I think vaccines actually are quite interesting. There are a few things in medical science where really the number one, I think the efficacy rate is above 90%. And that really is the case for some of the vaccines on the market, like Pfizer and Moderna. These are being used in Singapore. So very effective. And I think most importantly, protective, and protective at several levels. In fact, there's a threefold protection that vaccines offer to the individual, to their family and loved ones, and to society at large, which is the effect of herd immunity. So that itself actually is one of the key reasons where you have this kind of situation where something you do has that sort of downstream impact on protecting your families and your loved ones and also society at large. In addition, I think we operate a number of vaccine centers, as Kuen Loon has shared. We've had the privilege of operating them in the CBD in Raffles City, but also in the community, in the Woodlands, Bedok, Clementi, most recently in Geylang. What's very good to see is that we have quite a number of elderlies come by. Some of them may have hypertension, cholesterol, diabetes. In those cases, it's especially beneficial because if one was to get COVID, the impact would actually be worse. They have a more severe form of COVID. And in those cases, actually, with a chronic disease in the more elderly age group, there is a higher benefit to taking the vaccine. For us which are working adults, I think there's also a benefit. Like I said, protects your loved ones. But also, I think in the future, there's some possibility that this would open the doors to travel in the future. So knowing this, for instance, really is quite a plus point.
Yeah, beautiful. We're talking to Dr. Walter Lim and also to Kuen Loon, both of the Fullerton Health group here. And Kuen, if I can come back to you, Neil touched a little bit upon it. There's, some people are still wary of taking it. I mentioned a bit earlier, my 95-year-old friend here and his 80-year-old wife had their first jab a little over a week ago. They feel fine. There was no adverse effects. When you look across the 8 different centers that you have and across the region where you're doing in Australia and other countries, are there differences in the way that other countries are approaching their distribution of the vaccine, different than Singapore in a positive way, a negative way? Anything we can learn from them and that you've learned across your health group?
Sure, Glenn. So currently, as what you mentioned, we have started in Singapore first, and in Australia, almost 45 of our clinics in Australia, our GP clinics in Australia, will be administering the vaccination as well. And you are right, different countries have adopted different approaches. So in Singapore, we are really using both the private and the public sector to come together to do it. So we do it at the hospital, we do it at the polyclinics, and we set up these large-scale vaccination centers throughout the whole island, right? And work very closely between the private and the public sector. I think in Australia, the approach is slightly different. Certainly, the private sector, like us in Australia, are also involved. So they have chosen close to about 45 clinics out of about 60 over clinics, GP clinics Australia, to administer it, right? And their approach is slightly different in the sense that instead of using large-scale vaccination centers, they're going to administer it and give the vaccines over the GP clinics. So they have actually authorized about 1,000 plus clinics throughout the whole of Australia. I think it's just the demographic that is different. I think one of the reasons why, and there's no right or wrong, right? It's just a national strategy. I think one of the reasons why they do that is because Australia is so big, right? It's very spread out, right? So it makes sense for a body to use that to approach it to the clinic's route. The point to take note is that if you do it, then you have to be very strong in giving SOPs to each of the clinics. The logistical chain will be a bit more trickier because instead of distributing the vaccines to 40 locations, now you have to do it almost to 1,000, 1,500 GP clinics.
Oh, right.
So the approaches are a bit different. I think in Singapore, because we are small, we are compact, vaccination centers is probably a more economical and a faster way to roll it out. In countries like in Australia, probably the other methods could be better. And we are seeing in some other countries, they probably use a combination of both as well. Again, there's no right or wrong. I think the key part is how the public and private sector come together. And this has to be a collaboration from both sectors, because the public sectors is also reaching their limitation in terms of dealing with the situation and just giving the daily care to all the patients, right? This is a additional task, a very important national effort on top of the daily work.
Yeah. You mentioned the national effort there, Kuen. I'm not sure if this is a question you could answer, but we're seeing in Europe right now a real fallout in terms of the supply chain demand. Some countries saying they haven't got enough. Some countries are being accused of hoarding and this and that. Where is Singapore in terms of supply and demand? How is our supply chain based upon your experiences?
Yeah, so that is a difficult question to answer, to be honest. I'm not privy to the supply. But at the same time, we have been receiving very steady supply of vaccines from the MOH. We work very closely with them. We know exactly what is the demand and the supply coming up. We have never come across a situation whereby we know that we have, let's say, 10,000 bookings today and we're short of the supply. So it is really a very closely knitted collaboration. And I would say everything has gone on smoothly. I don't think you've heard of situation whereby we are short of supply so far, right? The MOH has really been doing a fantastic job in trying to match the supply and demand.
If I could add on there.
Yes, please, Walter.
What has been very interesting is that